Kate Burke, City of Spokane.
Arnie Woodard, Spokane Valley Council.
Bob Lutz, Health Officer.
Tony Smith, Spokane Regional Health District.
Kevin Freeman, City of Millwood.
Chuck Hafner, at large, or what am I?
You're the king.
Okay.
Karen Stratton, City of Spokane, and assistant to Chuck Hafner.
Michelle Fossum, Legal Counsel.
Ann Pitznall, Recording Secretary.
Okay. Well, thank you very much. Today, the three county commissioners and Dr. Condon will not be here. As you well know, the commissioners are all back, I think, in Washington, D.C. To a annual meeting of representatives and senators and so forth to look at types of things that they can do in their city business. So under those circumstances, I hope they come back with some good things for all of us and for our particular area. At this time, then, it will be open to citizen input.
No one has signed up.
Okay, no one has signed up. Okay, well, thank you very much for that. Chair report. There was a question that came up last month from one of our citizens regarding who is responsible relative to vaccinations. And if you recall, we've been sitting and talking about that for, gosh, months and months and months. And the question was, who is responsible for coming up with guidelines for each school district to follow? And so to make a public announcement as of today, the Central Valley School District had a format that was well taken by all the other superintendents of schools, of the other local schools, and looking very quickly at what they had done. And but it still comes back to each individual school district board needs to approve the format in which they go forth. So if you do have any questions about why one district might have a different wording and what their regulations are relative to vaccinations, in regards to that, it just simply matters, you can remind them that it's up to that particular school board of each district in order to handle that. Also, for those of us that were able to attend the awards and recognition reception yesterday, again, as we reminded everyone, that once a year they recognize the citizens for the health district. They provide a 5-year recognition, 10 years, 15 years, 20 years, and 25 years. And it's a very, very nice ceremony. So we'll continue to remind the board members, if they have the opportunity, to attend. And I know that myself and Breen were there yesterday. I know there's others that were going to attend, but knowing how busy all of you are, things just happen, and makes it sometimes impossible to do that. But a very, very good ceremony and very worthwhile the time to do that. Do we have any updates in any of the committees? Breen, I'll start with you. Do you have an update, please? Oh, and welcome.
Thank you. Yes, so we did meet and we basically charted out a plan for the year that's going to have two components. One is we're going to build, as was suggested I think from this group, towards a legislative reception where we can share with local legislators our priorities. So we're going to figure out when that will be and then work back from that on how we're going to do that. And then the second thing is we just penciled out some times to start addressing potentially new issues that we think the board might be interested in. And so we're going to vet them a little bit within our committee and then bring them forward for information and education of the board to see if the board wants to do anything more.
Okay, thank you. Any questions of Breen regarding that? Karen, do you have a report?
So it looks like...
And what board do you represent?
Education.
Okay, thank
and
you.
I think, Ann, we got a meeting scheduled?
Yes, it's on the side.
I just saw that. Great. So we have our first meeting scheduled on May 17th.
Okay.
And we'll be looking at topics that we want to talk about as far as education. So I'll keep you posted.
Okay, and if I recall correctly, one of our commissioners in charge of the finance is gone, so there will be no report there. Any questions regarding or concerns about the committees that we have? Okay, hearing none. At that time, let's go to number 5, agency report, please.
Good. We'll have 2 reports, starting with Dr. Lutz.
Where is it down there? just a little different than typical start for my presentations. If you haven't checked out the falls, I certainly encourage you to do so. Right now, it's flowing at about 20,000 cubic feet per second. Its maximum is 49,000 cubic feet per second. And so 20 did some math, envelope math, and that would essentially fill the stadium every 2.54 seconds. So kind of cool. Amazing to think about it. The Spokane River is 111 miles long. Its drainage basin is 6,240 square miles. It's the primary source, recharging source for the aquifer, which is our sole source aquifer and source of water. So an incredible resource that, again, we really need to take care of going forward. So if you haven't been down there to enjoy it, I strongly encourage you to do so.
Well, thank you for the report, Dr. Lex.
Okay. Of course, I have to continue to talk about influenza. It's finally tapering, thankfully, but again, we've had 606 hospitalizations. Again, still primarily influenza A. You'll see by the graph that it certainly has picked up with respect to influenza B, and certainly in the senior population, great concern here. But the graph, and it's the red line specifically, we're looking at how you can really see how it peaked and then dropped pretty precipitously, then had a small little uptick a couple of weeks, about a month or so ago, and then has dropped off again precipitously. So thankfully, I think we're at the point where I may still continue to talk to you a little bit about it, but not quite with the same regularity. But again, you look at 40 deaths, unfortunately, due to influenza this year. So for us not to think that it is a infection that causes significant morbidity and mortality is, again, doing it disservice. Just two community activities I want to talk about. First of all, you probably are aware of the fact that the county commissioners last week decided to look further into joining other communities across the state and actually across the nation at a lawsuit, class action type of lawsuit against different pharmaceutical industries. Purdue Pharma, certainly as the maker of OxyContin, has received most of the notoriety, but they're looking at, again, sort of other pharmaceutical companies that have been at some level promoting and marketing some of the pharmaceuticals incorrectly, such that at least at some level a cause, or at least a portion of the cause for opioid addiction. The other thing is Tranquil Terminus, and again, it was in the newspaper a couple of weeks ago. This was actually a really interesting and exciting opportunity to be a part of. It was an exercise, it was a national exercise that was initiated by the federal government, Department of Health and Human Services, and specifically the Assistant Secretary to Preparedness and Response. And it was an exercise to sort of test the system. Essentially, what happened was they identified 4 patients, 4 virtual patients, but actual individuals that were potentially contaminated, infected with Ebola. And these individuals were in Boise. So once they were identified within the system was activated, and they actually flew this 747 aircraft out from Atlanta to pick up those 4 individuals and then transport them to what are called special pathogen units. One of them is here at Providence. And so this was an exercise of all parts of the system. So DOH was intimately involved with us. We were intimately involved, as was Providence, AMR, other community resources and assets, to sort of test the system, to look for issues, problems that may arise, just in case it actually happens. So this is, again, an image of the 747. This is one of these very interesting units. They are self-contained biohazard biocontamination units. They can treat a number of individuals, 4 individuals, but again, self-contained. And the amazing thing is that they are disposable to some degree. Literally everything in there that cannot be sanitized is disposed of. But it's an incredibly complex system, very interesting to take part of and to really appreciate the science behind it. This is just another image. And so again, imagine, if you will, that they had these two individuals who were coming to the Providence Special Pathogens Unit. They brought them off the aircraft. They dropped them down on that platform. AMR was there in their hazmat suits. Individuals, one at a time, were taken to the Special Pathogens Unit. So kind of exciting to be part of that project. And that's all I have to report. Any questions? The E. coli problem with romaine lettuce, yes. Yes, it is a problem. It's been identified that, for those of you who may be not familiar with it, there has been a concern about a contamination of lettuce coming from Yuma, Arizona, and there have been some individuals in our community, specifically one family, that has been affected, albeit they did not get the lettuce locally. They were actually traveling when one of the family members became ill, and unfortunately other family members have likewise become ill. But we have not had any local cases of contaminated lettuce at this point, but we're still monitoring for it.
Okay, thank you. Any questions for Dr. Letts? All right, thank you very much.
Of course.
Mr. Smith?
Good afternoon, and thank you. Uh-oh. I'm not sure why I got the security alert. I have a few things to share with you. First of all, for today, Linda has nothing from the policy perspective, and Mike had nothing from budget. What I want to have a chance to cover with you are a few things that have gone on here that have been quite exciting. The first is that we, just a week ago, did an introduction to health impact assessments. And these are tools and techniques that can be utilized to help understand the impacts to human health from policies that may be implemented. Councilwoman Thompson was here. Thank you very much for attending. Coming out of that, there was very positive support that this would be something of interest. It is designed to go to people who are policymakers and folks who are going to influence policy. And there will be a full-day training on June 13th here in the Health District for any people who would be interested in attending that. You can certainly touch base with Ann if you want to get more details around that. We are working on our strategic plan, as you well know, and it's been fun to try and look at how do we align the work that we do as an agency with what's happening in the community. And the picture that is here is representative of the work that was done by a broad group of community residents. Somewhere in the neighborhood of 400 different people participated throughout the overall process to identify priorities for the community. Priority Spokane was sort of the focal group that pulled this together. And as identified here, the first priority that was selected by the community is to address family trauma and violence. The second priority is increase access and service for residents with co-occurring substance use and mental health issues. The third priority identified by the community was to improve affordable housing. These are all public health issues. And so internally, we have worked with staff and done focus groups to identify what are the things from an internal perspective that we have begun to look at. And I just read you down the list of the things that we have begun to also look at. Access and barriers to care, child development, drugs and alcohol, healthy eating and weight and physical activity, housing security, economic development and security, infrastructure and built environment, mental and behavioral health issues. So a lot of crossover. And in addition to that, we look at other surveys and work that we do in the community, the reports that we put out, the quality of life survey that was done. All of that data is put together. Linda Wilson is leading our Goal 4 group, which is developing our strategic plan. And Kate has graciously said that she will participate in that as a board representative, so thank you very much for that. So that is underway. We will keep you apprised of how that evolves as we go through our strategic planning, which would be in place for 2019.
Tony, as you and I had spoken to the other day, I brought up the subject of during this process, was sex trafficking at all come up, and did it come up? And, because I'm finding out there's very little resources that seem to be available to see where we are relative to that.
Within the various focus groups that met, I do believe it had been mentioned, but it never rose to a height of priority within the final project. So it is something that some folks in the community are aware of and are working toward, but overall did not rise to the top.
Okay, thank you.
I think part of that, as we had mentioned the other day, Chuck, is that it is an incredibly serious issue, but the number of people that are impacted, I think, is small compared to many of the other things that are identified, and I think that weighed in terms of prioritization.
Well, the interesting thing, I think that the FBI, there's an agent located in Post Falls that's really involved with that, other than that in Lutheran services, family services. But other than that, it was hard to glean any other resources available in our community. And here again, when we speak about it, as a group, we know it's a serious matter, but it may be more serious when you talk about San Francisco or Seattle or some of those coastal areas rather than inland, but I'm sure it's happening here too.
I am sure, and for any of the families impacted is just as serious for them individually.
Okay.
Well, I just had to add to that. I know it's been on our radar as a city. We've had quite a few folks come and testify on it, and kind of thinking about possibly doing a study around sex trafficking to see actually how many people are affected by it, because we don't really have a number. We have data from 2008, but that's kind of the newest data that we have, and so we're looking into possibly doing a study or seeing if there's any other resources out there. We do have one officer that specifically works on sex trafficking in the city, so.
Well, Kate, could somebody that's interested, are you leading up this group, or?
I'm working with Brian and Lori on this. So.
Okay.
Human Rights Commission as well.
Yeah, so.
So who would this person contact the city of Spokane? Who would be the
They can
logical
contact
person?
me, yeah.
Can contact you?
Sure.
Okay, good.
Thank you.
All right, thank you. Anyone else? Sometimes I forget to look on this side, so Michelle, if you have anything to say, yell at me, will you? So,
I will.
Okay. All right, thank you.
So the next thing is what Chuck Heffner had already spoken about, that we had our Years of Service and Recognition Award, and thanks both to Chuck and Brian for attending that. It is meaningful to staff to have representatives from the board here. Along with the Years of Service Award, there were 3 special awards that were given to the agency. And the first, the person on the right there, Mike Lascola out of our Environmental Public Health Division, received a state award called Grace Under Pressure Award. And this came from the State Office on Drinking Water. And Mike received this for all the assistance that he provided to Airway Heights with the PFOS/PFOA issues that were going on and the contamination of the water supplies up there that he has for quite some time, and continued to work with that community and answer questions for individuals there. The other 2 awards that were given were presented, the information by Health Promotion Director, and at that point, Kyle Unland talked about an award called the ZO8, the ZO8 Award, which is given by the Healthcare Authority, and it is a Washington Wellness Award. It recognizes organizations that have built and grown sustainable wellness programs. And this agency was a recipient of that, and we thank our Living Well Committee and Kyle, who is a representative on that from our executive team, for leading that effort and continuing to work with our staff to find out how can we provide opportunities for our staff to be as healthy as possible. The other was an award called the Golden Apple Award, which came from the Association of Washington Cities, and it recognizes outstanding employee health promotion programs in the state of Washington. And that is given both to public and private entities across the state. And again, this agency was a recipient this last year, so we are very proud to have been recognized for that great work. Ultimately, it really is important to work to maintain the health of our employees. That's what we stand for. Helene Dewey, who is that individual right there, and myself were able to go to a health department in Houston, Texas, the Harris County Health Department, who is recognized as a leader in the nation for work that they do in health equity. And clearly, following the enormous hurricane damage that happened in Houston this last year, for us to have an opportunity to understand how did they work to make sure that they were trying to impact those citizens they have who have the least resources, as well as those who have great resources. It was a terrific visit for us to have the opportunity to see what goes on in that kind of a health department. They have a little more resources than we do. Their budget's about $100 million a year, and they were able to buy 4 or 5 semi-trailers that they equipped with all of their health department programs and drove them to neighborhoods. So sort of something we're not quite in the same capacity level to be able to do. But then the rest of their staff spent an entire day with us talking through policies and programs that they have in place that we will look at how we can begin to implement those here as well. So that was a very exciting time for us, and we have brought back a lot of resources. We have also continued our re-accreditation efforts. We are now in the position where we have submitted our application. We then have 8 weeks to do our review and get all of our materials submitted. We're about 2.5 weeks into that process, so that will continue as we go forth the next month and a half, and we will have that submitted to Public Health Accreditation Board in another few weeks. Finally, you probably have seen a fair amount of information about tobacco and how the state of Washington receives a lot of taxation dollars, but very little of that goes back to fight tobacco. And here locally, we have done a program called Done My Way, which looks at individuals within our community who have found a way to stop their use of tobacco.
That was the norm. Everybody was smoking. Back in 1965, cigarettes were like a quarter a pack. In 2013, they were $8.25 a pack. I decided, well, I'll just save the money. In the course of a year, you got enough money for a Hawaiian vacation or Disneyland, you know, I mean, thousands of dollars. This is one of the key factors that helped me to succeed in stopping smoking.
So, an example of one person who identifies what was the motivation and the way that they could stop their smoking, and now how I can stop the overall program. Stop. There we go. So those are the items I have to report to you today. Any questions?
Are these on TV?
Yes.
Yes, they're on YouTube. If you Google Done My Way, you can see a whole litany of those, one of whom is an ex-employee here who demonstrates why he had quit. So.
Any questions? Thank you, Tony.
Thank you.
Okay, item number 7, there are no action items or reports at this point in time. And item number 8, please.
Did you miss that?
Beg your pardon?
Did you miss that?
There we go.
Oh, I always miss one. Okay, let's go to number 6. Meeting minutes of March the 29th, 2000.
I'm going to turn on your mic.
Thank you, Arnie. Let's start with number 6. The consent agenda, meeting minutes of March 29th, 2018. Do I hear a motion to accept, please?
So move.
Second.
Any concerns, questions? All those in favor signify by aye.
Aye.
Okay, thank you. And then the vouchers, March 1st through 31st, 2018. Do I hear a motion to accept that, please?
To accept it.
Second? Is there a second? Thank you, Kevin. All those in favor?
Aye.
Okay, thank you very much. Any opposed? I never want to say that one. Because when you say opposed, then it means you've got to have a long conversation, discussion. Okay, now can I go to item 8? Okay, reports. We're now ready to go to item number 8, please.
All right. Good afternoon. My name is Tiffany Turner. I'm the program manager for the Public Health and Healthcare Response Program here at Spokane Regional Health District. And I'm going to come and present to you. We've done this a couple times in the past to Board of Health, and just talking about how response happens in our agency and our community. And we thought we'd make this kind of an annual event for all the new board members that are now here. So some of this is a repeat for some of you who have been here before, but never hurts to refresh. So I'm going to start off and again just talk about one of our foundational public health services, and that's about all hazards, emergency preparedness and response. And so today, the short time I have, I'm going to just describe for you kind of an overview of our programs here at the health district, and then different planning activities that we're involved in our community to improve our ability to respond to different incidences that happen. I'm also going to talk about a couple different response strategies, lessons that we've learned from those responses, and then also identify different ways that you as Board of Health members can be incorporated into this, and not only as Board of Health members, but also as elected officials in our community and leaders in our community. So different ways that you can plug into these efforts. So a little bit about overviews about the different programs we have here at the Health District. So the first program is our Public Health Emergency Preparedness and Response Program. It started out in 2000 with like one person and has evolved over the years based on different incidents that have happened. You know, it started off with smallpox efforts, vaccination efforts, and then it went into the anthrax and the 9/11 and pandemic, and then most recently the Ebola that Dr. Letts referred to. So a lot of different ebbs and flows of the program over the years, but some activities that have remained consistent. We still work very closely with our partners in the community to plan and ensure that we're ready to respond. We work internally with our staff here in our agency to ensure that we can still maintain services during an incident. So those other essential public health services that are critical to our community here, you know, having a continuity of operations plan to make sure that we can still perform and provide those services to our community is one of the program goals. We also work a lot with medical countermeasure planning, so that involves making sure we can get medications and vaccinations out to our community in a timely fashion. And then communication is a huge role during response, as Kim knows. It's critical for us to work with partners in our community to make sure that we work together to develop and disseminate messages out to our public so they understand what's going on and what the risks are and what they can do to help. And then we really have done a lot of work recently on vulnerable populations to ensure we have the equity piece and making sure that all people in our community have access to the services that we provide and have the access to the information that we're sharing. The other program that we have is the Healthcare Coalition. This program actually started in 2005, I believe it was, and in response to, we have all these different healthcare agencies in our community, and a lot of them are private agencies and systems, and there's no one coordinating body to pull them all together during a response and to coordinate efforts. And so the coalition was developed in response to that need. And so we have over 650 healthcare and response partners that cover the 10 counties and 3 tribes in eastern Washington. And in July of this year, it's going to undergo some major changes. We're actually expanding our services and our programs to cover all of eastern Washington. So we will now, as of July 1st, be covering 19 counties and 4 tribes of eastern Washington. So a lot of expansion in that program happening. That program is really responsible for making sure we have some sort of a common operating picture amongst healthcare entities in our community during a response, helping work prior to response and planning together and building systems and support medical surge as it happens in our community. So do a lot of work around patient movement planning, patient tracking planning, information sharing, how do we gather situational awareness from our healthcare partners in the community and then distribute that back out for situational awareness to all our partners. And then the last program is the Medical Reserve Corps of Eastern Washington. Probably many of you have heard about that program. They provide a really valuable service to our community by offering different services both during disasters and before disasters and helping build resiliency in our community. They do that by helping out through vaccination clinics. They have medical booths at different community events that we have. So if you're running Bloomsday coming up here, make sure and look out for their booth during Bloomsday. And then the last, probably most notable activity that they undertook was the naloxone project. So that's where volunteers were trained and then went out and thus trained law enforcement officers on how to administer naloxone to reverse drug overdoses. And I believe thus far we've heard about 4 lives that have been saved because of that training that's happened. So great success for that program. So again, some great programs with some fantastic accomplishments. I want to quickly go over planning that we've done with partners just recently. We've had alternate care facility planning that we partner with American Red Cross, and those facilities are intended to set up to offload the surge from hospitals during an incident. So we have an agreement with American Red Cross to co-locate our shelters, our alternate care facility with their general population shelters. The intent being that these shelters, these facilities will take those lower acuity patients that aren't ill enough or injured enough to go to a hospital, but they still need an elevated level of care more so than the general population can provide. So that's what the alternate care facility planning is. Our MRC, we also work with them to staff those alternate care facilities and provide that medical care and support services. The other thing you probably also heard of is Cascadia Rising was a great big statewide exercise that happened last year, and that involved an earthquake scenario happening primarily on the West Coast, but of course having impacts for us on the East Coast here, or East Coast, on the east side of the state. I wish it was a coast. And that involved, either trying to figure out if it's better to move patients out of the west side and thus move them over here to the east side of the state, or if it's better for us to ship in resources to the west side. So a lot of that discussion and planning happened. Dr. Letts referred to our highly infectious disease exercise that we just conducted, the Tranquil Terminus. Again, testing our, first time we've tested our Ebola response plan for Region 10. So a lot of lessons learned there and improvements to our plans and how we notify partners and communicate with partners and protect our responders and our community from those infectious diseases. Just last week, we participated in a Bloomsday active threat exercise. That was really interesting. That first time we've really done that as a community, and we're able to just sit around a table with all the parties, key stakeholders that participate in Bloomsday, from the planners of Bloomsday to fire to law enforcement to health, and really discuss, what would happen if we had an active shooter down at Bloomsday. And so it's an eye-opener when you think about, the masses of people that are down there and how we're going to respond and how we're going to deal with mass fatalities during an incident like that, how we're going to get responders into the scene, how we're going to identify, the runners that are on the course, if they don't have ID on them, how do we go about notifying them, how do we communicate with family members who are worried about their loved ones that are running the race. So we need to set up some sort of family reunification center, family assistance center to help the families identify where their loved ones are. And then the last one is coming up here in May, is we're doing a first huge hospital evacuation exercise. It's not a full-scale exercise, meaning we're not actually going to move patients out of a hospital, but we're going to simulate moving over 250 patients out of one of our major medical hospitals. And so that's going to test our ability, our hospital evacuation plans on how we can do that, along with testing our plans on where we place patients in our community, working with other hospitals and other skilled nursing facilities to accommodate those patients, and then working with transportation resources for how we're going to get those patients from one hospital to those other alternate facilities. So a lot of great work happening there as well. Some other exercises we continually do, COOP exercises here in our agency. So again, testing our ability to provide continuity in our services and identifying backup staff and backup systems to be able to make sure that happens. And then also during Bloomsday, just to let you know, during the actual event, the running event, we're going to be testing out our patient tracking new plan that we've created. And so what that'll mean is during Bloomsday or Hoop Fest, any people that are actually transported to the hospitals during those events are actually going to be issued a patient tracking band, and then once they go to the hospital, they will be entered into a patient tracking system. So it's going to be the first time that we really test out that patient tracking plan. So I'm really looking forward to learnings from that and being able to implement that in our community. I want to talk a little bit about how incident response happens, both at our agency level, the local level, and then up to the state and federal levels. So it starts off, usually incidents start off, especially in public health, small, local. We try and handle them within our agency with the resources and agreements that we have with other partners. We utilize what's called an incident command system to manage our incidents, where we have identified staff that are assigned specific roles with specific responsibilities, and then we identify objectives for that exercise, or identify objectives for that incident, and then strategies for how we're going to execute those objectives. The health officer has broad authority during an agency public health response to contain disease and control measures. And again, we have various different agreements and resources throughout our community that we pull on. But once an incident exceeds our ability to respond internally as an agency, that's when it can go escalate to a community response, or something like happened with Windstorm is when it is a community response. At that point, usually our emergency coordination center is activated, and for those of you that have been involved in that, that's happens at the fire training center that's out by SCC, and that's where all the response partners come together. So the ESF 8 is the emergency support function 8 that public health is part of, partnering with other healthcare partners, mortuary partners, and mental behavioral health partners to really come together to decide how we're going to respond to a particular incident. And then usually the lead during a community response is really based on who has administrative or jurisdictional authorities. So sometimes it may just be fire as the lead, if it's a massive fire or something like that. If it's something like with the recent Ebola exercise, public health was in unified command with some of the other major response players. So with the airport, with the airplane coming in, with the hospitals, with the patient, and with transport services and Washington State Patrol for security. So it was kind of a unified command where we come together and develop objectives and strategies. During a community response, the mayor or the city council can issue local declarations, and what that does is it allows us access to additional resources, and it also is important in the sense that once a declaration is made, if an incident escalates to an even higher level to where we qualify for federal reimbursement for funding, it's important we have those declarations in place to be able to qualify for those reimbursements. And so luckily during Windstorm, we as a county declared an emergency, which allowed many of our agencies and cities to get reimbursed for some of the costs that they had during that. And then up to a state or federal response, again, declarations, our governor can declare an emergency at the state level, again, accessing additional resources, federal resources such as the National Guard can come in and help once the state has declared an emergency. And then the other thing that declarations can do is they can allow the governor to waive particular regulations. And so what we found, though, that like during the Cascadia exercise is we thought the governor had the authority to waive certain regulations, but there had been some legislative changes that have happened that ended up removing that authority for him to waive those regulations, and kind of backfired on us during a response. And so they're really looking at that now on how we can reinstitute some of his authority to be able to waive regulations, say, for instance, for hospitals, critical access hospitals, to take in more patients than they're licensed for. And then so like Cascadia, fires, of course the hurricanes, like Torney had mentioned, all were state or federal responses, declared responses. And then also at the state level, the Secretary of Health can also exercise their legal authority, and they can do that in conjunction with the health officer or and the Board of Health, or if the health officer is not able to fulfill his responsibilities, then the state Secretary of Health can step in, and the state health officer. And then I'm not going to go over all these WACs and RCWs, but just as just kind of a summary that pretty much the health officer has pretty broad authority to institute any types of control measures needed to contain disease and institute disease control measures. So that might be isolation, quarantine measures, that might be requiring people to wear masks during a pandemic, that may be shutting down public venues if that's a source of disease spread. So lots of different options there. Hopefully we don't get to those extremes, but can take some minimal control measures prior to that. I'm going to send out, or Ann will help me send out the PowerPoint after I'm done here, so you'll have access to these WACs and RCWs if you want to reference those. And then just kind of talking a little bit about what we've learned from different responses. So during windstorm was really one of the first times that we as a community activated our Emergency Coordination Center. We as public health, again, worked with other response agencies to ensure we had shelters open, and then looking at identifying those vulnerable populations in our community and how do we find out what their needs are and make sure that their needs are being taken care of. So did a lot of that work. One of the great things that came out of that windstorm was Avista is now started a critical infrastructure project, which involves identifying facilities within our community that are critical to the continuation of services in our community. So pre-identifying those, mapping those, so they can in turn, when we have another major power outage, can make sure we get power to them as a priority over other places. So that's a great outcome of that. Of course, during mumps, enabled us to test a lot of agreements we have with different partners in our community, such as the schools of nursing and the schools of pharmacy that helped us come in and do vaccination clinics, helped improve control measures within the schools, so documentation of vaccination at the college level was improved because of this effort, and then tested our ability to provide vaccinations to a large population. And tested our plans for that. So another great outcome of that response. Influenza, as you saw from the Dr. Lutz's influenza report, this last season was a pretty severe season for our hospitals and healthcare community. And on a daily basis, our hospitals are at or near surge capacity already. And so something like a bad influenza season, and this wasn't even the worst, but really put a lot of strain on our healthcare system. And so our healthcare coalition really worked closely with hospitals and healthcare partners within our community to try and alleviate some of the stress that they were undergoing. And so they worked with them to develop policies around visitation recommendations, and worked with them to develop some decompression policies to work with, say, long-term care facilities to try and offload some of the patients from the hospitals so they can then take care of some of the more severely ill. We also conducted a lot of resource management. Some of you may have heard about the saline shortage that's been happening with some of our healthcare facilities. So the Healthcare Coalition coordinates with healthcare entities in our community and across state lines. We worked with Idaho. They had a huge shortage over at Kootenai Health that we worked with partners in our community to help them out. get through that shortage. We had the norovirus incident as well at the House of Charity. Again, one of the other times that we activated our Emergency Coordination Center. As a result of this, they had great improvement in their infection prevention procedures at the shelters and coordination between the shelters. So that's happening now to where if something's happening at one shelter, they're going to work with another shelter so we can maybe determine, one shelter is going to be our sick shelter and one shelter can be our well shelter. So they've done some great efforts there internally, as well as really identifying some of our vulnerable populations and how do we work with the homeless community and make sure that they're taken care of as well. Then we had, of course, the Freeman shooting incident, which really brought together all of our mental behavioral health partners. So there's still an ongoing group with those partners that are working together to determine how we best coordinate those services if something like this were to happen again. So that was a great outcome of it. It also rejuvenated our communications group. Kim did some great work with our area hospitals in helping them develop key messages and share those messages, and media, working with the media to get those messages out. So that group is a great resource for us to draw upon during an event and make sure we have, again, coordinated messaging to our public. And then it also really brought to light the importance of a family reunification plan, and something that we have a framework of a plan in our community that has been ongoing process working with American Red Cross and Salvation Army. Cindy's done a lot of work with them to develop a plan. And then, like I'd mentioned, this active shooter exercise really helped us talk through how that plan would be implemented, and we'll continue to build upon that plan. So as far as your role, besides as far as in response, you would be probably called upon as, we may be asking you for help with approving additional financial resources if we need it to respond to an event. We're going to be notifying you guys of anything that's major events that we want you guys to be aware of what's going on and what our response actions are in that type of event. As an elected official, you may be invited to the Emergency Coordination Center and participating in those discussions and decisions that are happening there at the Emergency Coordination Center. But other activities that, as a Board of Health member or elected official, that you can really key into is just informing yourself. So, there's a couple courses out there. Again, these links will be provided in the copy of the presentation. There's an 808, which explains our role as an ESF8 lead, and then there's a 908, and that's for elected officials and what you need to know about emergency management. So both those courses are short courses. They're like an hour long, so not a huge time commitment. And then, of course, taking our messages that we're sharing with you and helping inform your constituents and colleagues on passing those key messages along to them. And then, of course, we might be relying on you to, again, share that information that you're hearing back from your constituents on what their needs are or what their concerns are, and to help us in our planning and response efforts. Would love to have you advocate for not only within your own agency but in the community for continuity planning and preparedness. So if your agency that you currently work for doesn't have a continuity plan, then maybe you can help lead that charge, because of course the more agencies and citizens that are prepared in our community, the better we'll be able to respond effectively. And then really building on resilient communities. So a lot of the great work that's been happening with the community health assessments is doing that. So encouraging, health access to health, encouraging partnerships in our community, involvement, educational attainment. If you're involved in any sort of policy planning and the implementation and influencing policies, thinking of how do these policies affect the health and the safety of our community. So really keeping those things in mind. And then, of course, when you get the chance, participate in any sort of exercises or planning. And the last thing I wanted to mention, we do have an alerting system that we're going to be using to alert Board of Health members, and that's called Secures. And some of you that have been on the board before are currently on that system. Those of you that are new will be adding your contact information to that system that Ann's going to be working with us to get your information put in the system, what that'll do is it'll allow us to send alerts based on the severity of the event. It'll be maybe through an email, or if it's a more urgent event, then it may be a call to your phone, to your desk phone, or to a cell phone if we need that sort of urgency. So be looking for, we'll probably go ahead, once we get your information entered into the system, we'll be doing a test alert, and so you'll be receiving that notice, and just strongly encourage you to confirm that alert so we know that we have the appropriate contact information. So just wanted to leave it with this. And Karen, will you please share your joke with the rest of the board that you, that was, has everyone heard
I
it?
think I shared it last time.
Did you?
You want it one more time?
I loved it. So I didn't know you guys had heard it before, so I just thought.
She's thrilled to death to say it again. I know she is. Yeah.
So what is the difference between the swine flu and the bird flu? The bird flu, you need treatment, and the swine flu, you need ointment.
I love that joke. Thank you. Any questions for me?
Well, Linda?
I have a question about how you talked about dealing with the rumors and the information that spreads on social media, like with the Freeman shooting, the parents were receiving texts from their kids and there were complete panic over that. I know you must be working on a plan for how to address that with your partners.
Absolutely. We have an emergency response, emergency risk communication plan that Kim leads that effort. And within that plan, there is a section pertaining to specifically social media and how we, during an incident, we'll actually have someone monitoring social media on a regular basis and addressing some of those rumors that might be getting out and trying to get the correct information out in a time, because we can't stop it, right? It's going to happen. So how do we best pose ourselves to respond and put the right information out there?
Any other questions of Tiffany?
Pardon?
Any other questions?
Yeah, I do. It's on.
Andrea?
Yes. Karen, just it kind of leads me to the next question of that you were saying that citizens need to be prepared. So do we have, for the citizens, general population, how do we educate them, like if there was a natural disaster? What, are we putting expectations on citizens, not the vulnerable population who obviously can't be prepared, but do we have a plan in place and expectations for the citizens of the community?
Yeah, so there's a lot of education out there right now. Ready.gov is a great resource to steer people to for how to create that plan. And so again, so those that can plan ahead of time and have communication plans that they're able to respond appropriately, and then in turn help those out that can't respond. And so really, as much as we can encourage that personal preparedness within our community by those various resources. American Red Cross can come out and do presentations. There's a lot of online resources that are out there. Does that answer your question, or I wasn't quite sure?
Yes, I think basically it does. Just because I was just like with Germany, I know right now they're trying to do more preparedness for their communities and emphasizing food storage and all these different things, and so I didn't know how we were outreaching to the community here.
Yeah, we do some on our website, but primarily we depend on Red Cross and emergency management to do a lot of that community outreach. But we try and share the message as often as we can.
Any other questions?
Yes.
A good, excellent report. I want to thank you for that, Tiffany. Secondly, if we talk about the Healthcare Coalition just a moment, because I understand that we are the kind of lead agency that helps support and leads that, and it's been in existence since, 2005? Mm-hmm. And it's extremely important with an area that we surround ourselves with providing health care. So could you just take a couple minutes and talk about that?
About the coalition just in general? Yeah, so as I mentioned, we currently have over 650 members within our community. Those members come from anywhere from the hospitals to individual clinics to urgent care clinics, mental behavioral health partners, dialysis centers, blood centers, so long-term care facilities. Those are all healthcare partners in our community that we work with alongside with public health, emergency management, and EMS agencies to, again, come together and be able to share information. So one of our primary purposes is information sharing. So we have a system set up to where if an incident happens, we can send out data collection tools to all of those partners in our community to determine what the impact is on their facility, what their needs are during an incident, such as if they have a resource shortage or a staffing shortage. And then they send that information back to us. We compile that into a report, situational report, and then share that information back out, and then work on how we can address some of the needs of the healthcare system. We have other tools in place. Like I had mentioned, we have our Disaster Medical Coordination Center that we help organize, which is Deaconess in our community. Disaster Medical Coordination Center would be activated during any type of an event affecting our healthcare facilities. So if we did have a mass casualty incident, such as a massive bus accident or train derailment where it impacted our community, the Disaster Medical Coordination Center would then be activated and then could send out alerts to all healthcare partners in our community to alert them of what's happening. And then that system, we also have WATRAC system, which enables us to track bed availability throughout our different hospitals in our community, as well as a place where they can have a command center that they can talk to each other during an incident and identify, again, what the needs are, who has resources, what the issues are, and so it's an ability for them to communicate with each other. That same WATRAC system allows us to do the patient tracking that I'd mentioned. So again, during a mass casualty incident, how do we identify those patients that are coming from the scene, which hospital they're going to, so we can then help with the family reunification of where they're at and be able to relay that information to the families. So those are, we have regular meetings and information that goes out to our healthcare partners in the community as well. So those are some of the activities.
With 650 members, how do you communicate then? Are there divisions? Are there segments? Or how do you really communicate with each other in regards to that?
So we have bulletins that go out on a regular basis, weekly, every other week, that go out to the broad distribution list of all those healthcare partners. And again, they can in turn share that information with others within their agency. And we have newsletters that go out. We have meetings every other month that we invite participants to. We have work groups that we have particular partners in our healthcare community that participate on these work groups to identify how we can improve, say, patient tracking or communication. So those are, we have the alerting ability through WATRAC system to send out alerts to all those healthcare facilities. We can do that as well from here as an agency. So those are some of the ways that we communicate with them all.
Sounds great. Anyway, any other questions? Thank you very much.
Thank you.
Now can I go to item number 7? There's no actions in that. We had, reports. Board member check-in, please. Starting with you, Linda.
Okay. Well, this is Our Kids Our Business Month, and went to the reception that was put on for part of that day. I wasn't able to go to the day-long training. Appreciated that Rowena and Jennifer from the Regional Health District, as well as many health district folks were there helping with that. And I'm sorry, I forgot his name, but a doctor who lost his, research doctor who lost his little girl Vivielle at the Sandy Hook shooting was the keynote speaker. And it was very hard to listen to him because to think someone went in and shot up a kindergarten and school people, and it's happening every day, and that we still are not having a lot of resolve on how to fix this problem or to help those who need the help to deal with it. But it was once again inspiring to think that tragedy is turning into action, and hopefully that with Our Kids Our Business we can move forward with that. So I appreciated very much having that. And as I'm listening to the reports today, thinking about the prioritization, the things that come up that you were talking about, Tony, about homelessness and our housing and mental health issues, it's the same things our youth are talking about with the Spokane Valley Youth Voice. And I had the privilege to attend the rally in Spokane Valley where the University High School and Central Valley kids came together and had a rally. And they did just a magnificent job of being very clear in their thoughts and had good solutions to put forward to the folks at the rally, had letter writing stations, had registration for voting stations, and then there were protesters there, teens who were protesting, and it was interesting to see how the protesters and those putting on the rally over the period of about an hour came together and could come to some kind of a decision that they were going to talk and figure out, because one young man read a poem he wrote that said, to the protesters of the protest, he said, let's have a cup of coffee. I think our feelings are closer than we think. And I just think our youth are emulating good solutions and at least trying to talk to one another. And as adults and leaders in the community, I think we have to learn from that and move forward ourselves to see how we can come with solutions, because tragedies continue to happen, and we just have to find ways to make a difference and to find solutions. And it is, when we talk about it being a public health situation, that helps us move past blame and bring people to the table. So that's my report.
Nothing today, thanks.
Nothing here.
Nothing.
You can always count on me. So I had two river-related reports since we started out with that. One, the City Council passed unanimously earlier this week an update on the rules in the river that would require personal flotation devices for everyone who's on an inner tube or anything in the river, unless they're just straight up swimming. And that's a collaboration we have with the Sheriff's Department, because the Sheriff's Department patrols the river, but we made it clear that within the city limits, have to have PFDs, which should help. Secondly, also in terms of river and flows, we're working on an ordinance right now. When the city, we're occasionally called upon to provide clean water to places that don't, like Airway Heights. And we're putting a little structure around it to make sure that when we're pumping water out of the aquifer and the river basin into some other aquifer basin, that we're going to take the revenues from that and put it into conservation. So over time, we'll be saving more water than we're pumping. So.
Good. Thank you. Okay. Karen?
I don't have anything.
Yeah, and I only have, kids are extremely magic. You and I know that. My whole career was involved with youth, and they do, and if you have them do anything, party. Kids were magic. Thank you. Nothing else? Do I hear a motion? Adjourn.
Move adjourn.
Second.
All those in favor? Okay, keep in mind, this is a record.